Radiation oncology involves delivery of radiation toward the tumor to help kill it, as well as kill any tiny cells that it might have spread outside the tumor in the immediate vicinity. Usually radiation, the most common form of radiation, is radiation from the outside or external beam radiation. There are other forms of radiation, like radiation through seeds or brachytherapy, that can be delivered as well. Typically, most patients get external beam radiation therapy, which is just like getting an X-ray, except this type of X-ray is a lot stronger than a chest X-ray or an X-ray for a broken bone. And our goal is to shoot these X-rays at the tumor as well as the surrounding areas to reduce the tumor and also take care of any tiny cells that might have escaped from the tumor over a course of anywhere from 2 weeks all the way to 8 weeks. The dose of radiation depends on what type of tumor we're treating as well as the patient. The radiation oncologist will assess each individual patient and make a determination that is unique to each person. The course of treatment, again, is about anywhere from 2 to 8 weeks. Each treatment lasts about 15 minutes a day, and it's just like getting an X-ray, so you can't see it, taste it, touch it, feel it, smell it, or anything. The first few treatments go really smoothly, and there are really typically no side effects, but over time, the body remembers the radiation dose that's received, and side effects can happen usually about after 2 weeks, ranging from skin dryness to other side effects depending on where the radiation therapy is given. Once a week during treatment, the patient will meet with the radiation doctor to discuss how they're doing, see if there's anything ongoing, and also discuss any side effects the patient has. And from a radiation doctor standpoint, we try to give medications or any other advice or solution to help the patient get through the radiation as best as possible. Sometimes radiation is also given with chemo because chemotherapy will sensitize the tumor to the radiation, and the patient will also see the medical oncologist in conjunction with the radiation oncologist as well. Now, after the radiation therapy is done, we will continue regular follow-ups with the patient to make sure the tumor stays away. I'm currently studying Ayurvedic medicine, and I also practice at University of Texas MD Anderson Medical Center. At MD Anderson, we have an integrative medicine department that routinely works with us to maximize our patients' efficacy of treatment and also look at side effects. Currently, we have an ongoing protocol studying the use of curcumin in radiation patients to see if that can help reduce some of the side effects and improve recovery time from radiation side effects. So patients who go through radiation therapy need oftentimes a lot of skin care instructions as well as nutritional instructions. I treat a lot of head and neck cancer patients who have radiation damage to their swallowing tube and esophagus and really have a lot of pain when they swallow. This oftentimes leads to weight loss and lack of adequate nutritional intake. So dietary guidance is extremely important. And this is where I think integrative oncology can come in terms of guiding patients as to what type of nutritional or what type of nutrition they should be putting through their mouths or their supplemental feeding tubes to help them improve their chances of recovering from radiation side effects as well as long-term disease-free survival or overall survival, meaning improving their chances of the cancer not coming back. I think oftentimes I think an important thing that's overlooked in a lot of patients is the emotional side and the stress of receiving treatment and going through a rigorous course of chemotherapy or radiation. And addressing those needs at the time of treatment, I think, is a responsibility of any oncologist. And if we do have a good integrative oncology support team, I think a referral can easily be made so that those issues can be addressed in conjunction with the other more physical issues that a patient goes through.